Three important life lessons I learned from taking care of patients who are dying. Welcome to Achieving Success Through Failure. As a surgeon, part of my practice actually takes care of people with cancer, the big C. And in that aspect, not all of the endeavors that I take actually are successful. There are going to be a group of patients who come in who are terminal. And the first question that I ask is there any surgical problem? Meaning, is it still fixable? Or do I need to perform something to actually improve their quality of life? And is it possible? The second question is for those people who have a resectable disease, at what stage they are, how we're going to perform it, is their outcome after. And for some, it's going to be a surveillance. It's going to be a monthly to a yearly surveillance. And unfortunately, some people come back with disease that progresses. And in that aspect, I end up learning a lot more from them, from their experience, from their point of view in which they are at the end of their life. And what are the things I've learned? The first aspect is a lot of people will go into a phase of denial. They won't come into terms easily of the fact that there is no cure, that the disease is progressing, and then the eventual outcome is actually death. However, as the patient goes on and as it takes time and a very careful conversation occurs, he then or she then comes to that point that they're able to accept that fact. And the earlier that they are, once it is actually a given, is the more that they would be able to convert or change their perspective about dying. And the most important thing in this aspect is how to utilize your time, because your options and your priorities actually change when you are at this point. All of the things which were important before or seemed important would actually be rearranged on what is truly valuable. And this may actually come to fruition between relationships compared to material things. And problems that you were thinking previously about your job may not be as important as how your family is going to handle the situation and how you are going to spend your remaining time in the end. And I think this is one factor that we have to keep in mind. At the end of the day, this is one of the things which are certain besides change is actually death. But given the fact that you are able to accept this earlier, and for people who have terminal diseases, that they are aware of this process, it is actually a life-changing moment that they are coming to grips of the reality of the finite, how finite life is. The second lesson that I've actually learned is actually to live. As I mentioned, a lot of the times we tend to have so many things going on that small problems become big problems on our perspective when we actually lose sight of the big picture. There are times we over focus on small things that don't really matter. And it comes to a simplicity of how you wanted to live your life and in which other people will remember you, and at the same time how you've touched other people's lives and affected them by your own. Because when I talk to people who are dying, they're not talking about their properties, but they're looking about how they're going to spend time, not as how they would want, but how they would want to make their family experience memorable moments before they leave. And this is so important that we're able to actually focus on this aspect, because we are living day to day and you never know when the time comes. And in this aspect, by actually learning to live and spend each and every moment as if it were your last. And that doesn't mean taking out the responsibilities, but actually learning to live in the present and cherish every moment. Not just about where you go, it's who you spend it with and how you cherish every moment and experience that you're able to be given is a valuable thing. Someone actually told me before that the past is history, the future is a mystery. Today is the present. That's why it's a gift. The third lesson that I've learned is that life goes on. It is either with acceptance, with a whole heart, or with anger, bereavement, and denial. And some people have this issue of undergoing this cycle and not being able to get out of it. And these are things that you have to understand and consider, in which there would be normal aspects of bereavement and depression that comes on losing a loved one. But at the same time, someone who loses a loved one must allow themselves to heal from the sadness and their own wounds, that they may actually be able to get up, move forward with their lives. And these are all the lessons that I've learned from talking to people with terminal diseases. Those people who have passed away and those people whom they left. And with all those lessons, the most important thing that you have to understand is to learn to live. I hope you guys liked the video. If you guys have any questions, please type it in the chat. And please click the like and subscribe button, and I'll see you next week.